Arterial blood gas analysis, or an ABG, is a test that measures the amount of oxygen and carbon dioxide in the blood, as well as the acidity of the blood. This test is an essential part of the diagnosis and a management of patients' oxygen status, as well as checking the patient's acid-base balance. As a brief overview, when the pH of blood is below 7.35, the blood is said to be acidic. Changes in the body system functions which occur in this acidic state will include a decrease in the force of cardiac contractions, a decrease in vascular response to catecholamines, and a diminished response to the effects and actions of certain medications in the body. On the other hand, when the pH is above 7.45, the blood is said to be alkalotic. An alkalotic state interferes with tissue oxygenation and normal neurological and muscular functioning. Significant changes in the blood pH above 7.8 or a pH that is below 6.8 will interfere with the normal cellular functioning, and if it remains uncorrected, it leads to death. The body self-regulates acid-base balance in order to maintain an optimum pH within the normal range throughout the use of a delicate buffer systems between the respiratory and the renal system. Let's then move ahead and look at how to identify acid-base imbalances and a discussion on the compensation aspect. Let us start with the buffers. Buffers are the fastest acting regulatory system which helps maintain the pH within a narrow, stable range through immediately neutralizing excess acids or bases when they are released into the body. The carbonic acid bicarbonate system is a primary buffer system in the body which maintains an acid-base balance throughout the coordinated actions of the lungs and kidneys. While looking at the lungs regulate carbonic acid by controlling the carbon dioxide exhalation. The respiratory rate and rate adjusts in response to various pH changes. For example, when there is an acidosis or a low body pH, the respiratory rate and the respiratory depth increases, promoting an exhalation of carbon dioxide, which eventually leads to a reduction in carbonic acid levels and an increase in the pH. On the other hand, when there is an alkalosis state or when the pH is elevated, the respiratory rate and the depth of respiration decreases. The carbon dioxide is retained in the system, increasing carbonic acid concentration and eventually decreasing the pH, making it acidotic. On the other side of the kidneys regulate the bicarbonate ions by selectively retaining them or excreting it. During acidosis, the kidneys excrete hydrogen ions into the renal tubules. And these hydrogen ions combines with the urinary buffers and gets eliminated in urine, retaining bicarbonate ions to buffer the excess acid. During alkalosis or states of increased body pH, there is excess excretion of bicarbonate ions, and this bicarbonate ions combines with sodium and gets eliminated in urine, therefore eventually reducing the body or blood pH. For us to identify acid-base imbalances, we need to understand what are the normal ranges. The normal range for the blood pH is between 7.35 to 7.45. The normal range of partial pressure of carbon dioxide is between 35 to 45 millimeters of mercury. Bicarbonate ion ranges between 21 to 28 milliequimoles per liter. The partial pressure for oxygen is 80 to to 100 millimeters of mercury, and the normal oxygen saturation is 95 to 100%. With the knowledge of these normal arterial blood gas values, we are able to recognize the abnormal and any imbalances that might occur. For you to analyze arterial blood gas and interpret the results, we start by assessing the blood pH. If the pH is less than 7.35, we say we have an acidosis state. And if the pH is greater than 7.45, we call that alkalosis. After confirming the pH, we now move to check the partial carbon dioxide saturation. If it's greater than 45, we call it a respiratory acidosis. And if the partial carbon dioxide pressure is less than 35, that is a respiratory alkalosis. The third step is to check the bicarbonate ions. If bicarbonate ions are less than 21 milliequimoles per liter, that is a metabolic acidosis. And if these bicarbonate ions are more than 28 milliequimoles per liter, we have a metabolic alkalosis state. After identifying which type of acid-base imbalance that is present, then we move to the fourth step of determining compensation. Compensation is either an uncompensated state, partially compensated acid-base imbalance, or a fully compensated acid-base imbalance, which we shall look at as we progress with the tutorial. How do we identify a specific or an existing acid-base imbalance? We use a mnemonic ROM. The R stands for respiratory, and then O is for opposite, M is for metabolic, and E is for equal. This basically means in respiratory acid-base imbalance disorders, we have opposite going parameters. And in a metabolic acid-base balance disorder, the parameters will be either equal or moving to the same direction. Let's have a look at this table here. We have a low blood pH and an increased partial pressure of carbon dioxide. Then that is an opposite relationship, meaning we are having a respiratory acidosis. If we have an increased blood pH and a reduced partial carbon dioxide pressure, that is again an opposite relationship. Therefore, we call it a respiratory alkalosis. On the other hand, if we have the pH that is reduced or a low pH and a reduced bicarbonate ion, that is a matching relationship, meaning we are having an acidosis state that is of metabolic origin. We call it a metabolic acidosis. If we have an elevated blood pH with an elevated level of hydrogen carbonate ions, hydrocarbon, with an elevated or increased levels of bicarbonate ions, that is again an equal or matching relationship, which we call metabolic alkalosis. It's going to the same side towards alkalosis. Therefore, it's metabolic alkalosis. When the body experiences an acid-base imbalance, it tries to compensate, or to bring back the pH to the normal ranges of 7.35 to 7.45. The lungs in this case will help to compensate for metabolic imbalances by adjusting the carbon dioxide levels, and the kidneys will as well help in compensating for respiratory imbalances through an adjustment in the bicarbonate levels. A compensation is a body process which occurs to counterbalance the acid-base disturbance. And a full compensation occurs if the pH is in a normal range of 7.35 to 7.45. If the pH is not within the normal range, we look at the respiratory and metabolic function indicators for us to identify or recognize if any compensation is occurring or we are still in an uncompensated state. If the condition is a respiratory imbalance, we look at the bicarbonate ions to determine the state of compensation, and as well, if a condition is of a metabolic imbalance, we look at the partial carbon dioxide pressure to determine if the respiratory or the lungs has compensated. So what are the types of compensation? We have three main types of compensation: the uncompensated state, partially compensated state, and fully compensated state. In uncompensation, the problem is detected, therefore the pH is still abnormal, and there is no any sign of the opposite system trying to fix this abnormality in the body pH. Only the primary value of either the partial carbon dioxide pressure or the bicarbonate ion is abnormal, while the other value is normal. For example, we could be having a pH of 7.30, which is an acidic state. Then we have a partial carbon dioxide pressure of 55, which is high, more than the normal, which is a ceiling of 45. And then we have a bicarbonate level of 24 milliequimoles per liter, which is normal. So for this case, we're having an uncompensated respiratory acidosis. When talking about partial compensation or partially compensated state, the problem is still ongoing, meaning that the blood pH is still abnormal. Then the opposite system has started to adjust or to compensate the value, making it abnormal too. So in this partial compensation, both values of partial carbon dioxide pressure and bicarbonate levels are abnormal, but the pH is still not back to normal. So everything is abnormal here. For example, we're having a pH of 7.30, that is acidosis. Then we have a partial carbon dioxide pressure of 55, which is high. And then we are having again bicarbonate levels of 30, meaning they're high. But in this case, the kidneys are trying to add more base to neutralize the acidic state of the body. Every parameter in partial compensation is abnormal. So therefore, we can say in this case, we are having a partial compensated respiratory acidosis. And lastly, we have fully compensation or a fully compensated state. In a fully compensated state, the original problem exists, but the body has successfully normalized the pH. Therefore, we are having both partial carbon dioxide pressures and bicarbonate levels abnormal, but the pH is coming back to the normal ranges. For example, we're having a pH of 7.38, which is normal, partial carbon dioxide pressure of 55, which is abnormal, and then we have an elevated bicarbonate ion levels, which is abnormal. This is a fully compensated respiratory acidosis. The pH may be normal, but still leaning towards the acidic or alkalinic state. We call it a compensated imbalance or a fully compensation. You can pause the video for a moment and have a look at this table. Try to identify what are the relationships between compensated, uncompensated, and partially compensated states of each of the four acid-base balance disorders. And lastly, what are the common causes of these acid-base imbalances? For respiratory acidosis, the major causes are of respiratory origin, that is hypoventilation, chronic obstructive pulmonary disease, drug overdose, and pneumonia. Respiratory alkalosis is caused by anxiety, hyperventilation, pain, and the presence of fever. Metabolic acidosis is caused by diabetic ketoacidosis, renal failure, diarrhea, and shock. And lastly, metabolic alkalosis can be caused by vomiting, nasogastric suctioning, diuretics, and antacid overuse.